Myasthenia gravis is a neurologic condition that patients fail to transmit their nerve impulses in their muscles so that they get weak with repeated motion or repeated activities. And that is thought to arise from antibodies that are produced by the thymus gland, which interfere with or block transmission of those nerve impulses, leading to the symptoms of myasthenia gravis. One of the treatments that has been there is surgical removal of the thymus gland, and that's been around for 40 or 50 years. And it was first noted by surgeons a long time ago that if you took the thymus gland out, in lots of patients, the myasthenia gravis will completely resolve and get better. Not in everybody, but that's sort of what happens. So in patients with myasthenia gravis who have their thymus removed, I generally tell patients that about a third of people who have their thymus gland removed will be medication-free, and their myasthenia gravis will be well controlled. About a third of people will be on dramatically less medication, but still need some maintenance medication for their myasthenia gravis. About a third of people will see no benefit. Our thoracic group believes that the more thymus gland you take out, the better the potential chance for remission. So when we thought about all these issues and having done all these different procedures, we felt the robotic procedure still offered us the best option and the best potential outcome for patients to remove as much thymus as possible. And so that's why we sort of have settled on robotic resection as our treatment of choice for myasthenia gravis in patients who need their thymus gland removed.
This young woman presented with drooping of the left eyelid, and the right eyelid is retracted. And you'll note that the retraction is in the primary position of gaze. She has full eye movements. I'm looking for a Kogan eyelid twitch of the left eyelid as she comes back up to the center position from down gaze. Full up gaze. Does have a twitch on the left. Now we're starting to give her intravenous tensilon test for a diagnosis of ocular myasthenia. Tensilon is in. Some watering of the eyes. The lids are pretty symmetric now. She's lost her ptosis in the left, and she's lost the lid retraction on the right. This confirmed a diagnosis of ocular myasthenia gravis. The response is persisting quite a long time. And now beginning to wear off.
My name is Olivia, I'm 19 years old, and I have myasthenia gravis. Myasthenia gravis is a rare chronic autoimmune disorder that causes severe weakness of the muscles. Right before I turned 18, my legs gave out on me and my eyes started drooping, and at that point I knew something was really wrong. On April 14th, 2014, I was finally diagnosed with MG. They diagnosed me with a test called the Tensilon test, and basically when the doctor pushed the medicine through my vein, I was symptom-free for the first time in 3 years.
Actually doing it for longer than...
It's already better.
Do you feel it?
Yeah, a little bit. Every 2 weeks, I get an infusion through my port, and each infusion lasts about 6 hours. Before the medicine starts, I get IV Benadryl to prevent any reaction, and it makes me sleep through most of it. I take 2 different types of medication for my MG. One is called prednisone, and the other is Mestinon. I take 2 Mestinon every 4 hours, and I take 1 prednisone once a day. All of these medications together help stop the production of antibodies and help prevent the breakdown of acetylcholine, which is needed for normal muscle function. The one comment that bothered me the most before I was diagnosed is when people would tell me to smile for pictures, but I just literally could not do it. The hardest part about having MG is that I wasn't born with it, so I know what it's like not to have constant weakness. My biggest support throughout this whole thing has been my family, my best friend Yasiel, and my boyfriend Jeremy. They've really tried to understand what I'm going through, and without them I don't know what I'd do. Another thing that's helped me cope with my MG is having a support group on Facebook with others who have the same thing as me. This support group has helped me so much because it's nice knowing that I'm not the only one living with this. MG is also known as the snowflake disease because every snowflake that falls is never the same, just like every person with MG has a different range of symptoms. About a year ago, I decided to get a tattoo of a snowflake on my wrist. I see my snowflake every single day, and it reminds me how strong I am and how far I've come. I'm currently a sophomore at Santa Fe College, and I'm working on getting my AA in health sciences. My dream job is to become an occupational therapist because I know what it's like to be on the other side and receive treatment, so it's made me want to help others.
One thing I've learned since having MG is I've come to appreciate the little things more, and I'm not going to let my illness stop me from doing what I want in life.
A living nightmare. That's how the woman you're about to meet describes her experience with a rare disease called Myasthenia Gravis. The condition caused her to become so weak she couldn't walk, talk, or swallow. After seeing several doctors, she ended up at Mayo Clinic, where medication and a minimally invasive approach to surgery helped her regain her strength and her life. To Samantha Munkemeyer, a walk in the woods is an amazing gift. Yeah. Samantha has Myasthenia Gravis, a condition that causes her muscles to become very weak.
The first thing that happened with me is I lost my speech. Then I couldn't swallow. My legs would just give out.
Myasthenia gravis is an autoimmune disease of the muscle, and it's caused by antibodies in the blood attacking the muscle and destroying the connection between the nerve and the muscle.
Dr. Brian Crum says it's not clear why this happens, but in some patients the condition may develop in part because of a small gland called the thymus. Medications such as steroids can reverse and control symptoms, as they did for Samantha. But another option is to remove the thymus gland. During the traditional operation, doctors access the thymus gland by splitting the breastbone. But Dr. Stephen Cassavy uses a minimally invasive approach. First, he makes a 2 to 3 inch incision in the neck. Then he places a special retractor that lifts the breastbone, allowing access to the thymus, which is underneath the breastbone. With specialized tools and a videoscope, he then removes the entire thymus gland through the small incision.
When you remove the thymus gland, it's not an immediate effect. It takes time for the body to wash out the effect that thymus gland was having.
Samantha had the surgery and is in the process of weaning off her medications. Her hope is that she can live symptom-free without needing medication. Dr. Cassavy says there is no cure for myasthenia gravis, and surgery does not work for every case. That's because sometimes there are other factors causing symptoms, but most patients do get better after surgery. And Samantha says it was worth it. She's already off some of her medications. After months of not knowing what was happening to her, Samantha says she entered her symptoms in MayoClinic.com symptom checker. Then she contacted the clinic for help. For Medical Edge, I'm Vivian Williams.